Dear Dr. Gardner, at what age should I start being aware of the possible signs and symptoms of endometrial cancer? So I would say at every age. Endometrial cancer is the lining of the uterus, and it's the most common gynecologic tract cancer in this country. The endometrial lining is the lining that sheds every month with the menstrual bleed. So, if there's irregular bleeding, that might be heavy bleeding on a monthly basis. It could be bleeding between periods. It might be bleeding after menopause. It could be just a change in your bleeding pattern. If that occurs, talk to your provider, ask questions. Do I need an endometrial biopsy? Do I need further evaluation for endometrial cancer? I would say that that's something that all patients should know about, regardless of age. In my practice, I've certainly seen patients younger than age 40 with a diagnosis of endometrial cancer. So it's important for all of us to take charge of our health, be proactive, ask questions, and be aware that irregular bleeding or a change in your bleeding pattern could be evaluated for abnormal endometrial cells, hyperplasias, or cancers. It's important to realize endometrial cancer is on the rise in this country, and that's a problem. So what we're seeing is that endometrial cancer rates are increasing at all ages, including some of our young patients. So it's important for everybody to be aware if abnormal bleeding, ask questions, see a provider, and get answers.